Imagine waking up with a small cut that within hours turns into excruciating pain, swelling, and a fever that won't quit. This isn't just an infection, it could be necrotizing fasciitis, the so-called flesh-eating disease that can destroy tissue faster than you can imagine. In the next 7 minutes, I'll take you through the terrifying reality of this rare but deadly condition, from its sneaky causes to the warning signs you can't ignore, and share stories of survival that prove hope exists. By the end, you'll know how to spot it early and what steps can save a life. Stick with me. This is knowledge you'll want in your back pocket. Let's start with what necrotizing fasciitis really is. It's a rare bacterial infection that attacks the soft tissue and fascia, a connective layer around muscles, nerves, and blood vessels, causing rapid tissue death. The term flesh-eating comes from how quickly it destroys skin, fat, and muscle, sometimes in hours. About 700 to 200 cases hit the US each year, but up to 1 in 4 people die, even with treatment, according to the CDC. Picture James, a 45-year-old hiker from Florida who got a tiny scrape on his leg in 2024. By the next day, his leg was swollen, purple, and screaming with pain. His story, shared on a survivor's blog, shows how fast this disease moves and why awareness is everything. Let's dive into what causes this nightmare. First up, the culprits. Bacteria, often group A Streptococcus, the same bug behind strep throat, but also Staphylococcus aureus, E. coli, or even Vibrio vulnificus from warm seawater. These bacteria sneak in through a break in the skin, a cut, scrape, burn, or even a bug bite, and release toxins that act like a chemical wrecking ball, clotting blood vessels and starving tissue of oxygen. Think of it like a wildfire, cutting off a forest's water supply. Everything dies fast. In a 2023 case, a Louisiana fisherman got infected after a small cut touched Gulf Coast water. Within 12 hours, he was in septic shock. The bacteria don't eat flesh. They poison it into decay. But how do you know it's happening? That's our next point. The early signs of necrotizing fasciitis are sneaky and brutal. Within 24 hours of a wound, you might feel pain way worse than the injury looks. Think a paper cut that feels like a knife wound. The skin may turn red, warm, or swollen, often spreading fast. Fever, chills, nausea, or flu-like aches can hit too. For example, Sarah, a 30-year-old teacher, noticed a mosquito bite on her arm in 2025. By evening, she was vomiting, with a fever and pain so intense she couldn't touch the spot. Her quick trip to the ER saved her life. These symptoms mimic milder infections like cellulitis, so the key is disproportionate pain or rapid worsening. Wait till you hear what happens if it's not caught early. Let's go there next. In the advanced stage, necrotizing fasciitis turns horrific. By day 3 or 4, the skin may develop purple or black blotches, blisters, or ulcers with a crackling sound called crepitus from gas under the skin. Pain might lessen as nerves die, but that's a bad sign. The infection can trigger sepsis, organ failure, or toxic shock, spreading so fast it's called galloping gangrene. In a 2014 case, Swedish musician Daniel Gildenlow contracted it on his back, spending months in the hospital after multiple surgeries. Without treatment, death can come in 12 to 24 hours. Survivors often face scarring or limb loss. 25% need amputations. This speed is why knowing the risks is critical, so let's talk about those. Risk factors make some people more vulnerable. A weakened immune system, think diabetes, cancer, or steroid use, amps up the odds. So do chronic conditions like obesity or liver disease. Any skin break, from a surgical incision to a splinter, can let bacteria in. Even healthy people aren't safe. A 2022 case saw actress Georgie Henley nearly die from a random infection at university. Injection drug use or recent viral infections like chickenpox also raise the risk. In coastal areas, Vibrio from seawater is a growing threat. 4 deaths were reported in Florida and Louisiana in 2025 alone. It's not contagious, but close contacts of Group A strep cases should watch for symptoms. Now, how do doctors catch this in time? That's next. Diagnosing necrotizing fasciitis is a race against the clock. Doctors rely on symptoms like severe pain and rapid swelling, but tests confirm it. A CT scan or MRI can show gas or fluid in the fascia, while blood tests reveal high white cell counts or low sodium. The gold standard is surgical exploration, a small incision to check for tissue that falls apart easily, often called the finger test. In a 2019 case, a woman's mosquito bite turned into necrotizing fasciitis. Surgery within hours of her ICU admission saved her. Only 15–34% of cases are correctly diagnosed at admission, so suspicion is key. Misdiagnosis as cellulitis can be deadly. Let's move to what can be done to fight this. Treatment is a full-on assault. Intravenous antibiotics like vancomycin or clindamycin are started immediately, but they're not enough alone. Dead tissue blocks blood flow, so surgery is critical. Surgeons cut away necrotic tissue, often multiple times, in a process called debridement. In severe cases, like James the Hiker, amputation saves lives. Hyperbaric oxygen therapy can help by boosting tissue oxygen levels. A 2023 study showed early surgery cuts mortality from 80% to 20%. Supportive care, IV fluids, blood transfusions, or ventilators tackles sepsis or organ failure. Survivors like Georgie Henley faced months of recovery with scars and therapy. Prevention is simple. Clean wounds with soap, keep them covered, and avoid water if you have cuts. If you're at risk, see a doctor fast for any odd pain. Let's wrap this up with hope and action. Necrotizing fasciitis is a rare, ferocious beast. Bacteria like Group A strep invade through tiny wounds, causing pain, swelling, and tissue death in hours. We've covered its causes, early signs like disproportionate pain, the devastating advanced stage, risk factors like diabetes or coastal exposure, and the urgent need for surgical diagnosis and treatment. Even with care, 1 in 4 don't survive, but early action boosts your odds. If you have a wound with severe pain, fever, or spreading redness, don't wait. Head to the ER or call 999. Share your thoughts below. Ever heard of this disease or known someone affected? Subscribe and hit the bell for more life-saving health insights. Thanks for watching and stay vigilant.